Aspivix is a game changer. So we've been using the tenaculum since the Civil War to remove bullets from men. And they thought, well, this little clamping medical device would be great to clamp for the cervix to stabilize it when entering the uterus, whether that be most commonly for IUD insertion. The real blasphemy here is that doctors have not told women how painful the procedure will be. And even if they do know, women are actually like, I'm opting out. They don't want to have that much pain. And so Aspivix is using a slight suctioning, a device that has, it looks like a little smiley face that goes onto the bottom of the cervix, and you pull the edge of the device and it kind of creates a little suction of air, and that in itself will stabilize the cervix with about 90% decreased pain, I believe, in their clinical trials. FDA approved, billing code exists, for sale already in the US. It's incredible. Women are reporting much, much more comfortable experiences. Some other medical devices that I'm personally really excited about, there's one called Hy-Ivy, Hyivy, Hy-Ivy, and it's actually created by a cancer survivor, Rachel. And Rachel's the founder, CEO, and she had cervical cancer in her early 20s. And radiation treatment for gynecological cancer can cause a lot of scar tissue. And she was given a dilator set, which essentially was the silicone cylinder-like devices that she was told to go home, insert into her vagina, and just break up the scar tissue on her own, which is incredibly painful and just traumatic and unacceptable in today's day and age of medicine. And so she's created this device that actually uses air to increase and decrease in size. It's self-lubricating. It even can have medicine inside of it to insert medicine into the vagina, and it uses heat, and it has this awesome dashboard that actually even sends the data to your pelvic floor therapist so that you can be monitored by your doctor in congruently in training and improving your pelvic floor. So I really love Hy-Ivy. Another one I'm really excited about is actually out of Ireland. It's called Nua Surgical, and it's the first ever medical device to support the C-section. So when you're getting a cesarean, it's huge abdominal surgery, and it's being cut multiple layers of your body, huge incision. And today's standard of care is that you have a nurse on either side of the table holding your abdomen open with their hands, because no one ever has made a medical device to hold open your abdomen for a baby to come out, which is wild, right? So when we talk about, creating things women don't need, here's a very basic entry to Femtech that we needed. And so the founder, Barry, he's created this, it looks like a very deep oval that can be inserted into the abdomen, and it is in a shape that allows for a baby to be removed from the abdomen. So really excited about that. It's going to decrease infection. It's going to decrease the pain after recovery, because you can imagine this is your body being held open. It's going to be much more comfortable for a woman after in recovery. The last one I'll mention is called Molly Surgical, Molli. And this one is also really fantastic, and it's for breast cancer. So women who have, doctors have identified a lump or something in her breast, and she needs to go in for a biopsy. Usually what she has to do is go to the hospital early in the morning. She gets a little metallic wire inserted into the side of her breast where the tip of it is pointing directly at the lump or the thing that needs to be biopsied. And this woman then needs to lay still until her surgical time. And it's not an emergency. And so sometimes she can be there literally all day with this wire hanging out of her that she can't move. Molly Surgical is just this little tiny bullet, itty bitty bullet that the radiologist, because that's how this wire is inserted, as a radiologist is looking in the machine while inserting it. They just literally put the bullet there into next to the lump. The woman can actually even go home. She doesn't even have to stay in the hospital. And then that's how they use it in the surgery. So I just really love this idea of this really bare minimum, almost barbaric version of medical care for women to being one that's accessible, affordable, and convenient, and safer, and less pain. I think that's also a really big thing that we're seeing a lot more, is people saying pain is not acceptable for women. Even though a lot of our biology induces pain on us, whether it be our menstrual cycle or labor pains, that does not mean that the medical system is allowed to induce pain on us.